Check the patient's chart and physician's orders, verifying medications to be administered along with the MAR. Review and be able to state medication reference information related to each medication, including action, purpose, side effects, normal dose, rate of administration, time of peak onset, and nursing implications. Review when last dose of each medication was given. Also ensure the patient's food tray has been ordered and will arrive shortly after administration of insulin. Perform premedication assessments as needed, including the patient's ability to swallow, current vital signs, and current labs, including blood glucose. Medication room. Wash hands. Prepare medications in a No Interruption Zone according to facility policy. Obtain the medication. If an automated dispensing system is used, enter the appropriate information and remove the medication. If barcoding is used, scan the MAR and medication. If a medication cart is used, unlock the cart, locate the correct patient drawer, and select the medication. Verify that the label of the medication matches the medication administration record, MAR. Verify the dose, perform any dosage calculation, and check the expiration date of the medication. If mixing rapid or short-acting insulin with intermediate or long-acting insulin, calculate the total dose and verify with another nurse. If the patient takes insulin that is cloudy, roll the bottle of insulin between the hands to resuspend the insulin preparation. Wipe off tops of both insulin vials with alcohol swab for 10 to 15 seconds. If mixing rapid or short-acting insulin with intermediate or long-acting insulin, using an insulin syringe, aspirate volume of air equivalent to dose to be withdrawn from intermediate or long-acting insulin first. Insert the needle into the vial and inject air into vial of intermediate or long-acting insulin. Do not let the tip of the needle touch the solution. Remove the needle and syringe from the vial of insulin without aspirating medication. With the same syringe, inject air equal to the dose of rapid or short-acting insulin into the vial, invert vial and withdraw the correct dose into the syringe. Remove any air bubbles to ensure accurate dose. Verify short-acting insulin dosage with MAR and then show insulin prepared in the syringe and the vial to another nurse to verify that the correct dosage of insulin was prepared. Remove the syringe from the rapid or short-acting insulin. Place the needle of the syringe back into the vial of intermediate or long-acting insulin. Be careful not to push plunger and inject insulin in syringe into the vial. Invert the vial and carefully withdraw the desired amount of insulin into syringe. Withdraw needle, check fluid level in syringe, and recap the needle. Verify long-acting insulin dosage with MAR and then show insulin prepared in the syringe and the vial to another nurse to verify that the correct dosage of insulin was prepared. Keep the needle of the prepared syringe sheathed or capped until ready to administer medication. Label the syringe with patient's name, name of medication, dose, route, and time. Check the medication label against the MAR a second time. Bedside. Enter the patient's room, provide privacy, perform hand hygiene, and don clean gloves. Adjust bed to comfortable height. Lower bed rail. Identify patient with 2 identifiers. Check patient allergies, assess patient knowledge of medications, and educate the patient as needed. Explain procedure. At the bedside, recheck the label on each medication with the MAR a third time before administering to the patient. Select appropriate site, rotating sites, and inspect skin for bruising, inflammation, edema, and palpate for tenderness. Cleanse the site with alcohol. Hold gauze between third and fourth fingers of nondominant hand. Remove cap of syringe. Hold syringe between thumb and forefinger of dominant hand. Pinch a fold of skin with your other hand and inject needle at 45 to 90 degree angle depending on amount of sub-Q tissue that is present. Inject medications slowly by using dominant hand to push plunger while holding syringe still. Quickly withdraw the needle and place gauze and apply gentle pressure. Do not massage skin. Activate the needle safety device and dispose of syringe needle. Dispose of gloves and perform hand hygiene. Return the bed to its lowest position, raise the top side rails, and verify that the call light is within reach for the patient. Reposition patient for comfort and assess any further need. If a medication requires a follow-up assessment of the patient, return to obtain information within an appropriate time frame. Educate the patient about the expected effect of the medication, safety, and the time of your return. Ask them to notify the nurse if their food tray does not arrive within 30 minutes of insulin administration. Properly dispose of any equipment used. Perform hand hygiene. Document all medications given to include date, time, route, dosage, site of injection, and patient's response. Document patient education provided.